Okay, everybody, welcome and thank you for joining us today. We're right at 12:01, so we'll go ahead and get started. I do know that we still have people that are joining us, but in the essence of time, we'll go ahead and get started. Hello and welcome to today's Healthy Minds, Healthy Bodies Foundation MedTalk featuring Sarah's Place, a closer look. My name is Jennifer Stanaway. I'm the Executive Director for the Albany General Hospital Foundation. Sarah's Place is located at Samaritan Albany General Hospital and is one of the many services that the Albany General Hospital Foundation is proud to financially support. I would like to thank the Haas Group as our Pride Partner sponsor for today's MedTalk. We appreciate all of you joining us today and are very excited to see the large number of attendees. I would like to remind you to keep your microphones muted during the presentation to allow for everyone to be able to hear. Today's presentation is being recorded. During the presentation, if you have questions, please feel free to enter those in the chat. Our speakers, Tasha and Emily, would like this to be an interactive presentation and will answer your questions during the presentation as they come up. I will be monitoring the chat and ask the questions as they are presented. We will also have time at the end for questions. It is now my privilege to introduce today's speakers, Tasha and Emily. Tasha Mosbrucker began her career with Samaritan nearly 20 years ago. Her Samaritan career began as a mental health assistant for Good Samaritan Hospital Inpatient Mental Health after completing a Bachelor of Science in Public Health in 2000. Her continued passion to want to take care of patients pushed her to go on to further and pursue a nursing degree. Upon completing her nursing education in 2005, she took a training position in perioperative services as a surgical nurse for 11 years, during which time her life expanded to include a husband, 3 kids, and a dog or 2. Tasha's interest and skills learned early on in mental health were never too far back in her mind. So in 2014, when the need presented for more sexual nurse examiners within Samaritan system, she signed up without any hesitation. Tasha joined Sarah's Place as a full-time sexual assault nurse examiner in August of 2016 and has never looked back. Emily Jaskoski is a proud wife and mother of 3 who loves hiking and traveling in her free time. Emily has been a registered nurse for nearly 7 years. She began her career working for Samaritan first in critical care and then moved on to the mother, baby, and labor delivery. Emily began working for Sarah's Place as a sexual assault nurse examiner in October of 2018, and she can proudly say that she has found her forever career. She is currently working towards certification as a pediatric SANE. Emily has loved working with children her entire life, and helping them during the most vulnerable and scariest times of their lives is one of the most important jobs she can think of having. Emily is proud and honored to work for Samaritan as they have prioritized patients affected by violence and continues to support such amazing community benefit. Thank you, Tasha and Emily, for being with us today, and I'll turn it over to you.
Thank you, Jennifer. Well, hello, and welcome to our virtual presentation for Sarah's Place. I am Tasha Mosbrucker.
I'm Emily Jaskoski.
And on behalf of the Sarah's Place team, we thank you for joining us and the foundation for this opportunity to be hosting the MedTalk in April. April also happens to be SAM month, and during SAM month, which is Sexual Assault Awareness Month, nationally organizations are raising public awareness about sexual assault. We're educating communities on how to prevent it, and we're bolstering prevention efforts throughout the month. So at the end of this presentation, we will give you some examples of ways that anyone can get involved and show support for sexual assault survivors. So in honor of Sexual Assault Awareness Month, it would only be right to show you the short film.
Bear with us with technology.
Got it.
Team versus team.
That's as good as it gets.
Oh man, I've never had more fun my whole life.
Daddy's had a beer. I'm gonna go to another one, dude.
It's your card?
No, Lamorne, stop doing magic. You're not good at it.
Guys! Oh, dude! There's a bear in your other room here.
Oh, that's just a big, angry, hungry bear. Just pretend it's not there.
Oh, really?
Yeah.
It'll just go away? What are you talking about?
No, I don't think it's going anywhere, but I don't know what to do about it, so I just ignore it.
So it's not dangerous, right?
Define dangerous. It's a bear. But, you know, it's not going to eat all of us. It only eats like 1 in 5s. I said only 1 in 5, so we're fine.
That's a lot, man.
That means one of us is gonna be eaten.
Statistically, that doesn't mean 1 of us. It means 1 in 5 people get eaten.
You're doing something about this, man.
Hey, what do you want me to do about it? You guys know the old saying, bears will be bears.
That's not a saying.
Lamorne, a bear will be a bear. So
You can't just blame the bear, not when it's attacking 20% of the people who come here.
20%. I said 1 in 5.
Yes, that's 20%.
And no, it isn't. It's 1 in 5, you math nerd. Let's pile on this guy.
Dude, you gotta get rid of this thing. Or at least warn us that there is a bear in the other room, man. We gotta look out for each other. What are you doing?
Hey, what happens between you guys and the bear is none of my business.
Wait, how is this none of your business, man? 1 in 5 people are gonna get attacked by this bear.
God, you're overreacting. The bear's not going to eat all of us. It'll be less than a quarter of us.
None of us should die.
It affects us all, Jake. 1 in 5. How can your door son so important? I can never protect your pride. 1 in 5, 1 in 5.
The majority is fine. I don't want to deal with this problem.
All right, so as you could see from that video, we shared a statistic with you. 1 in 5 women will be sexually assaulted by the time they leave college. So we wanted to start with that because it was kind of fun and light, but also we want to share some more statistics with everybody. So they're listed on here. I'll also kind of read through them for you, but we want you to know everyone is affected by sexual violence. And if we don't know the scope of the problem and that it exists in our communities, then we can't work together to prevent it. So 1 in 4 women will be a victim of sexual violence in the state of Oregon in their lifetime. Of all the women, ages 16 to 24 are at an elevated risk, which that video also kind of showed. 1 in 8 men will be victimized. 67% of LGBTQ community will be sexually assaulted, and 66% of domestic violence victims are also sexually assaulted by that same partner.
And now you have Sarah's Place. Sarah's Place is Oregon's first and only 24/7 freestanding sexual assault clinic. And just to define sexual assault for us all, sexual assault by definition is any type of sexual activity or contact that you do not consent to. Sarah's Place is special. We take care of people who have experienced a type of violence that no one wants to think about. Our approach to care with patients really shifts the focus from what's wrong with you to what has happened to you.
So we titled this slide The Old Way, but the old way actually still happens to be the current way for most communities. As you saw on the last slide, we are the only sexual assault clinic in Oregon, and so we are the only community that doesn't do it this way. So prior to the opening of Sarah's Place, a patient would present to their respective ED and check in for care. It might be that the only SANE nurse that is on is working a shift and can't be available until the end of their shift. So as we all know, most hospital nurses are working 12-hour shifts. So that could mean a delay in care of up to 12 hours and even longer if there's not a SANE nurse available. This delay in care can mean the difference of these patients receiving potential life-saving prophylactic medications for HIV or forensic evidence collection. These exams for these patients take place in the noisy, busy emergency department. And the best case scenario is that a SANE nurse was available, but sometimes this exam would be completed by an ED physician or even an ED nurse.
So here's a quick snapshot of what one of our consultation rooms looks like. This is actually the first place that we bring our patients after they have quickly triaged at the emergency department. In this consultation room, our first priority is to establish safety and comfort. For our patients, the care we provide is about setting them on the path to healing. So if a patient doesn't feel safe and secure within their environment, then we really can't move forward in the next phase of care. And for example, that looks like giving them a warm blanket and a meal. We titled this slide "The New Way," which really focused our services on strengthening immediate access and delivery of quality of care by specially trained sexual assault nurse examiners. Specifically, again, created to provide a safe place for patients to receive resources and care. All of our services are free, in part from our Sexual Assault Victims Emergency Fund allocated from the state, and with Samaritan's ongoing commitment to support our patients and community. We are staffed in-house days and evenings with a call response under an hour during the 11 p.m. to 7 a.m. hours and weekends. We are protocol driven. That means we provide options to care in the form of a full medical forensic exam, which can include medical screening exam, evidence collection, emergency contraception, sexually transmitted disease prophylaxis, HIV risk assessment, and prophylaxis, and most importantly, connection with our community advocates. We are also able to offer free follow-up appointments for patients, which includes a patient able to come back to discuss concerns they have. It's usually hard for patients experiencing trauma to remember all the information that we are going over with them during the acute exam. We can also offer STI testing, sexually transmitted infection testing, and again, go over community resources available to them. We have also recently rolled out a program called TabCloud. It's an app which you can access from any personal desktop computer, your phones, which is a HIPAA compliant and secure way for patients to stay communicated with the SANE. And it also, more importantly, can help with follow-up reminders for follow-up care if they weren't sure if they wanted an exam during the acute time when they were here, the initial acute time they were here, and then also let them know about advocates in the community.
Are there any questions so far, Jennifer? We wanted to check in.
No, we have no questions in the chat so far.
Okay. This is another consultation room here at Sarah's Place. We have two. This one is more family focused. We would opt to use this one in the case of a pediatric patient. We can also use this room if the patient presents with their children to kind of entertain the kiddos in while they're getting an exam. We currently at Sarah's Place have one SANE nurse who is trained and certified to care for the pediatric sexual assault population. And I, Emily, am in the process of completing my training and my certification to care for this pediatric population as well. And when we talk about pediatric population here at Sarah's Place, we're referring to all patients 14 years and younger. All SANE nurses in Oregon who are certified can care for patients 15 years and older.
So Emily,
Yeah.
sorry to interrupt. We do have a question that just came in. It says, what is RN SANE coverage?
what is our, I'm sorry, I don't think I understood it. What is our?
It says, what is RN, so like registered nurse, SANE coverage?
Oh, okay. I'm guessing that was in relation to the slide before. And we were just talking about our nurses here, our SANE nurses, SANE RNs, covering Sarah's Place during those hours. Does that answer the question?
Jenny, if that doesn't answer your question, go ahead and restate your question. That would be great. And then I just so everybody is clear, SANE stands for Sexual Assault Nurse Examiner.
Any other questions?
We just had a question that said, what does SANE stand for? But again, that stands for Sexual Assault Nurse Examiner.
So this is our favorite part. Let's take a look at how Sarah's Place has benefited the community. And as you can see, about 1 year prior to Sarah's Place opening, we saw a combined 70 patients in the Samaritan System emergency departments. Then after Sarah's Place opened, within the first year, we saw about 215 patients. And now 5 years later, we have seen close to 900 patients at Sarah's Place.
Of course, all of the work we do here could not be done without our community partners. So we've listed some here. This is not an all-encompassing list, but we work very closely with ABC House and the doctors over at ABC House when we talk about the pediatric population. So 14 and younger, but we also work closely with them 15 to 17 years old as well. They would be the doctors that guide those exams for us. Center Against Rape and Domestic Violence, that is CARDVA, and CARDVA are the community advocates that we would call. They support our patients, they help our patients with safety planning, things like that. There's Lynn County Child Abuse Network. My sister's place is similar to CARDVA. They are over on the coast. They serve Lincoln County, and they also will come to Sarah's Place with patients that are coming over from the coast area. And then Oregon State University, the Survivor Advocacy and Resource Center.
So we invite you again to join us in our activities to bring awareness to sexual assault and Sarah's Place services all during this month of April. Some of you may have already gotten these in your departments. The Sarah's Place team has been getting them out to folks. These envelopes have crossword puzzles in them, and so if you'd like to take part and fill out a crossword puzzle, you can enter it to win a Sarah's Place t-shirt. And if you're somebody out in the community that doesn't work within the Samaritan system and you would like to take part, please call us and we will figure out a way to get you one. And our number is in the next slide, I believe. So we'll make sure to get that out to everybody. Oh, yep, it is. Jennifer, any new questions?
We do. We have a question that says, does Sarah's Place only serve Lynn County, or are other IHN counties able to refer members to Sarah's Place?
Question. So no, we see anybody. So other counties can also refer patients to Sarah's Place to get care. Yeah.
Yep, we see anybody and everyone.
Those are all the questions we have at this point.
Okay, so again, how you can help support Sarah's Place patients, first and foremost, is if somebody discloses to you, is just let them know that you believe them. That is something we all can do for our community. And then of course, take part in our SANE events. We think they're pretty fun, and that happens every April. And then we invite you to come take a tour. Just call us and we will set that up.
We also invite you to call us with any questions. That's another way you can support patients here at Sarah's Place, is just getting them into touch with us or asking the questions for them.
So we do have a few questions and comments. Cindy is reminding everybody that services are free and not charged, and we are a nonprofit and do see everyone. We do have a question from Ursula. Do you have any idea of how many people you see from Lincoln County each year?
Yeah, I'd say about 20 roughly in the past year. Our goal is to really collaborate and build those services and see how we can improve access to care for those patients. You know, our primary goal for a patient is to try to keep them in their community where all their resources are. And so we look forward to working with the coast hospitals to see how we can meet their needs. And of course, we will take any patient. We want any sexual assault patient we can help. But again, if a patient wants to stay in their county, like Lincoln County, then we would love to support services out there and be a reference for education for the community and Samaritan.
Okay, thank you. Kimberly is asking, are there any male SANE nurses?
There are none at Sarah's Place. Yeah. There are, I mean, I've heard of male SANE nurses. I've seen them at conferences, but none here at Sarah's Place.
And then we have a question, is there a role for volunteers to help at Sarah's Place?
Yes, right before COVID, we were in the building discussion of getting volunteers lined up and approved to help out here in Sarah's Place. So stay tuned for more information on that, because yes, we would love to have volunteers.
Okay. And then Dr. Grupus has a question. Would you like to unmute yourself and ask?
Hi, thanks. I'm an ER physician over in Newport, and first of all, this is an awesome resource, and I think it's great, and it's a struggle on the coast to maintain SANEs and have the resources that we need. One of the barriers that I see, and I don't think has been addressed very well, is how, number one, to I guess sell the idea of sending somebody from Lincoln City or Newport to Albany for this, because they're coming to their hospital to be taken care of, and we haven't really been educated very well on. I mean, you know, I should have a spiel or something that I can say, look, this is really great, and I probably know more about it than my other physicians, having the role of being the director of the department for 9 years until recently. But I'm not sure what to tell folks to tell them to do this. And secondly, the transportation thing is somewhat of an issue as well. And I'm just curious if, I mean, we really need to explore that as well. I think there's a relationship with the Pac West ambulance service right now. And the last time that I sent somebody over in that ambulance, I lost EMS transport for other patients as well. And so it's not a great plan. And I think we want to get people over there, but there are those barriers, and I'm just not sure how to address those.
Yeah, we definitely want to help work out those kinks and see what those gaps are and figure out a plan that's best for everyone. Right now, I would urge any clinicians to call when you have a patient, because we are available 24/7, and we will help navigate that minute by minute. The last thing we want to do is have the barrier be transportation. These exams are very timely, especially with the HIV medications and them getting to start that within the first 72 hours. So absolutely, our goal would be to get them here as quickly as possible and help facilitate that.
Okay, thank you.
Sorry, that's the short answer, because presentation. There's a lot to look out, but definitely well. Thanks, Dr.
Can I show follow up on that a little bit? That's one of our goals too for the next 2 years, is to really get something that works well and yeah, with the coast. So that's one of our big goals here at Sarah's Place for the next 2 years as well. So much more to come on that, Dr. Grupus.
Okay, and we have a comment that Charissa has said, I agree, Dr. Grupus, especially taking into consideration that many people would not want to ride with a stranger for an hour or two to get there. This is a difficult piece. We do have a question from Daryl. Daryl's asking, have you had interest from other organizations from around the state who want to establish a similar place program in other communities?
Yes, we've had in the past, Eugene has come and toured. I think the biggest thing is you've got to have a commitment from the hospital and community to fund it, because it is ongoing, you know. So I think for other facilities, unless they have that infrastructure and commitment financially, it is difficult. But again, we are very fortunate and lucky and appreciative to be able to work here at Sarah's Place and have Sarah's Place.
So we do have another question from Carla. I've read that SANEs are hard to find and a few new entrants into the field across the U.S. Is that true? And if so, what is Sarah's Place or Samaritan doing to improve the situation in that regard?
Yeah, so we keep up with competency and education through our sexual assault task force on the state level. And so our task force that's put forth by the Attorney General works to network with out of state. And then when we go to conferences, networking with folks really helps to bolster efforts for training new SANEs and discussing the work and how we can progress.
So Jody is asking a question similar. It says, do you work with nurses who are interested in training as a SANE nurse?
Yes. Yes, we definitely have. Part of the training for Oregon, the task force sets forth a couple exams to be precepted, and we have done that. We had a couple folks at Good Samaritan Hospital that took the same training in addition to their primary jobs, and we have helped get them exams here. Yeah.
Thank you. And then Karen has a comment and a question. Is there a way to work with Rideline to support transportation? Perhaps a meeting with them could help this.
Yes,
Yeah,
great suggestion. Yeah, definitely. You know, our advocates, we just recently had a patient from the coast, and maybe Dr. Grupus, you happen to be involved with that patient, but my sister's place, advocacy in Lincoln County, came with the patient, and I know that they, realizing that transportation is a huge issue, riding with strangers, that is something they are addressing right now and trying to get funding. And so in this area, in our Lynn and Benton counties, we do have CARDVA that does have funding for transportation. So any patient that needs help getting here can call CARDVA, and they will safely transport them and are trained in that advocacy role. And then law enforcement have also been very supportive of bringing patients here. And one of the things we like to stress is that even if somebody calls for help from law enforcement to get to Sarah's Place, they do not have to be reporting the sexual assaults. Law enforcement keep that boundary, and we have a great partnership to where they will support patients and get them here for the care that they need without continued reporting or anything. Yeah.
And then we also at Sarah's Place, transportation, we don't ever want to be a barrier. So we will also provide taxi vouchers for patients that need those.
Okay, thank you, ladies. We do have a few more questions, but I think we'll let you go ahead and proceed with your presentation, and then we can come back to those questions. We want to make sure you can get through it.
It's actually a good time for questions because our next is just our virtual tour, so we can keep going with whatever's in there.
Okay. So Dr. Grupus does have a comment says it would be nice to have a handout to give to victims, specifically targeting the benefits of going through the uncomfortable idea of traveling that far to get the best care from all of you. I would go through it with them. So that's a suggestion.
Yeah.
Great suggestion. Taking virtual notes.
Okay. Teresa says, I would think that the hospital patient advocates could support this messaging piece as well.
Mm-hmm.
I think that's all of the questions at this point. Just a reminder, we've had a question if the PowerPoint slides would be available. This is being recorded and can be shared and will be shared as well. That's if you guys want to go through your virtual tour, that'd be great.
Great, yeah.
All right, so this is where we tell everyone to fasten your seatbelts and place your tray tables and seat backs in the upright position, because we're going to go on a virtual tour of Sarah's place. So when you look at this picture, you're looking at our main hallway. So you can see kind of at the very end of the hallway there is a door. That's the main door that comes into Sarah's place. That door is locked and has limited access, so not anybody can just walk in and out. We have a phone outside and also a doorbell that doesn't sound like a loud, startling doorbell for patients, or you can pick up the phone and it'll ring the inside of Sarah's place so that we can come let people in. And that's to help provide that safety for patients. There's not going to be anyone just coming in and out of Sarah's place. The other two doors that you see kind of on the side are our exam room doors. And so you have already seen pictures of our 2 consultation rooms. We also have 2 exam rooms. So we do have the capacity to be able to see 2 sexual assault patients at once when that need arises.
And again, just another shot of our consultation room. And this again is the first consultation room where we'll bring patients in, get them comfortable and feeling safe. You know, this is definitely different than going to the emergency department and going into a room, the only room with a stretcher, and then hearing other patients beside you. So this is very specific to Sarah's place and sensitive to the needs of our survivors.
And that couch does fold out to a bed, which is nice because sometimes they'll be here in the middle of the night and have small children who are sleeping, so we can make that an area where somebody can sleep if they need a nap. This is again looking at the other consultation room that's just more family friendly. I won't talk too much about it because we did earlier.
So this is the exam room, of course, with the stretcher and all the supplies necessary to do vital signs. We also do our actual medical forensic photography. This would be the time where we're capturing those sensitive photos of any injuries, be collecting evidence in the form of sexual assault forensic evidence kit. And then if a patient is wanting to report, then that kit we actually will end up taking to our evidence room, which is down the hall outside of this room for later collection by law enforcement.
This is a picture of the patient bathroom in Sarah's place. So one thing throughout that we tried to make sure of was that it felt a little more homey. It didn't feel so sterile and hospital-like. So you'll notice we have just a normal shower curtain and towels that are not white towels and from the hospital. So yeah, we like to offer patients showers if they want them after the exam process, of course. And references.
On to the next.
Are there any other questions?
So Ursula, who is the executive director for our Pacific Communities Health District Foundation in Newport, did place a statement that their Women's Giving Circle may be interested in providing a grant to help with transportation in Lincoln County. So she would like to reach out with, or talk to the 2 of you.
Yeah, that would be great. And our phone number's on the slides, but I can verbalize it right now so that everybody has it. It's 541-812-4420.
Okay, thank you. And then Kimberly is asking, are there any planned lunch and learns for physicians and assistants? It's not just the ER where patients land.
Right. Yeah, actually, now that COVID and we're lifting restrictions, we're trying to get back out in the community, primary care clinics, urgent cares, and come to staff meetings and help talk about our services and how to access those. Yeah.
Those are the only questions that I see at this. Oh, it says, can you put the phone number in the chat? Maybe Cindy, if you could put the number in the chat, that would be great. And then I guess I would open it up at this time if anybody would like to unmute themselves and ask a question. So Amber posted in the chat, the protocol for response in Lincoln County is that 911 dispatch, law enforcement, or hospital contact a SART, S-A-R-T advocate. We review their options and go over the benefits of Sarah's Place with a survivor. As for transportation, MSP helps navigate and works with our local resources as well as Sarah's Place to arrange elements like this. Often the SMP advocate meets them with the local hospital as well as Sarah's Place. We have been processing options with Sarah's Place to streamline this process and fill gaps in a trauma-informed way. We are highly interested in anyone who wants to partner with these efforts. And then she has listed her email in the chat, which we can get to you.
Great.
Do we have any other questions for Emily and Tasha? Ursula, go ahead.
Yeah, hi. So I guess I'm just curious, this is more of a overall question about sexual assault in general. Over, the history of sexual assault, the victim has often been blamed. I'm just wondering if you're seeing any differences in community perception, law enforcement perception, the victim herself or himself. Are you seeing any differences in sort of attitudes about that victim blaming piece?
I think we're working hard to see differences in it. I can say for myself, I've only been a SANE 2.5 years, and so to see those changes, I feel like I may have needed to be a SANE earlier on, but I still feel like patients come in here and often blame themselves. It's definitely a problem, and we're trying to work towards educating the community and teaching more about
Prevention.
Yeah, not being victim blaming.
What was the last part of your question again, Ursula? I didn't quite.
No, that was it. I mean, there's community perception, there's the victim, him or herself, and then there's law enforcement the way law enforcement behaves when they come in as well. So just wondering if you're seeing, over time, just seeing any difference.
I think definitely it's just going to be constant ongoing education, with law enforcement, community, and the schools, anyone. I mean, we'd love to educate as many people as we can. It's hard with statistics because reporting is only as good as people that want to come forward and report. So, looking at that and wondering, is the culture shifting? What are we seeing? It's really hard to get a definite answer in that. But, all we can do is believe in our efforts, our prevention efforts, and let patients know we believe them, we support them, and we have services for them. Yeah.
Okay. Okay, I'm not seeing any other questions in the chat. If anybody would like to answer a question or unmute themselves. Carla, go ahead. You raised your hand.
Yes, hi. So first of all, I just want to say thank you so much for what you do. You know, it's very important to our state, to our community, and so I appreciate that. Can you say a little bit more about the follow-up services that are offered to survivors of sexual assault and what sort of, you know, counseling programs and that sort of thing Sarah's Place gets involved with?
Yeah, so follow-ups at Sarah's Place, that's something that we started doing just out of seeing that there was kind of a need for patients that didn't have a primary care provider. You know, we're letting them know that you want to follow up in 3 weeks with somebody to have additional testing, make sure everything that we did here for you today works. Also, we give them so much information at their acute visit here on site when they come see us that first time. I could imagine that after trauma and getting all that information that they do not remember even a quarter of what we tell them. And so it's yet another nice time that we can go over some of that information with them again. And so there was just that need. We have so many patients that maybe don't have a primary care provider or don't have health insurance. And so that was the way that we could fill that for them, is those patients can come here and do their 3-week follow-up visit with the SANE nurse on site. And so our medical director has worked to create order sets and protocols for us to be able to do that for patients. Mental health, that's always the big mouthful, right? We refer to Linn County Mental Health usually, is how that goes. Of course, if there's an acute need for mental health services due to somebody being suicidal, we would send them to the ER. But we don't actually have mental health services here at Sarah's Place.
Okay. Do we have any other additional questions? We do have a comment here. It says, may I just say real quick, I appreciate the term being used survivor instead of victims. As a survivor, the word victim seems to be triggering and bring back all the memories and flashback. Thank you for the trauma-informed care.
Excellent. Yeah. Thank you.
We'll be up a few minutes if we have other questions or anybody else would like to unmute and ask a question.
I do have one last thing to add. We can't forget to mention our newly appointed medical director, Dr. Daskalos. And so we are very fortunate to have him join us and help us on this road to prevention and treatment for our communities. Yeah.
Wonderful, thank you. Thank you again, Tasha and Emily, for sharing with us about Sarah's Place and the important work that your team does in caring for our community. And it does look like we have a couple more comments. Charissa is saying SANE is a wonderful program and the nurses are so caring. Thank you. Lots of thank yous.
Thank you, everyone. Thanks for coming and being interested in what we do here. We appreciate it. We appreciate all your support.
Thank you again, Tasha and Emily. And thank you again to the Haza Group, our Pride Partner sponsor. And thank you again for all of our participants for joining us today. We would appreciate it if you could complete the survey that will be posted in the chat momentarily, and it will also be emailed out. And we hope that you will join us for our next MedTalk on Wednesday, May 19th from noon to 1 for the topic of revolutionizing cancer treatment. Join radiation oncologist McGowan, MD, as well as the radiation therapy care team with Samaritan Cancer Program to hear about the exciting new technology at the Samaritan Pastega Regional Cancer Center. Learn about the new cutting-edge linear accelerator and the Varian True Beam Edge, plus gain more insight into a patient's journey while receiving radiation therapy. The team will also cover topics such as types of cancer most often treated with radiation technology and what to expect as a new patient from consultation through the ringing of the bell ritual. Thank you again for joining us, and I hope everyone has a wonderful day.
Thanks again.